Hi everyone, welcome back. So today I'm going to be talking about the IT or iliotibial band, which is a sheet of connective tissue that runs down the outer edge of the thigh from the hip to the knee. This generally is going to be tighter, the muscles, because it is connective tissue, which is a thick and fibrous material. But certainly, sort of from my work, the people who really are at probably particular risk of having problems with their IT band are runners and cyclists. So it's important for you guys to know some self-help measures that will just help to prevent any inflammation on this IT band, and therefore prevent any issues with the hips and the knees. So I'm going to be talking about causes of IT band syndrome, which can basically cause lateral knee pain, so pain on the outer edge of the knee. I'm going to be talking about the causes. We're going to be talking about symptoms and how you can treat this and what you can do when you're out there running or cycling in particular. What you can do to help prevent these problems from arising in the first place. Okay, so here is the diagram of the knee. Now you can see here you've got the kneecap or the patella in the middle here. Tendons either side of the knee. So this one here is the quadriceps tendon, which goes up towards the thigh and then coming down towards the calf. On the edge of the knee here, just tucked behind, you've got the retinaculum, and then these are your quad muscles, as I say. So you've got your vastus medialis and your vastus lateralis, and this one here going up into the rectus femoris, which also is the one quad muscle that actually crosses the hip and so acts as a hip flexor also, whereas the other three quad muscles are really just, they just cross the knee, so they're used for the knee extension. And then this piece of tissue here, outlined in blue, so that is the IT band or iliotibial band, and that, as you can see, crosses the knee joint at a bit of an angle, and then it continues to run all the way up the lateral side of the thigh up to the hip. So as we've said, the IT band is a sheet of very thick connective tissue that actually forms from the gluteal muscles up around the hip, and it stretches from the top of the tibia, which is down here, and all along the outer thigh up the femur. And so it basically helps to abduct the hip, so raise it out to the side, and also to stabilize the knee in flexion and extension. So the IT band will basically pass across the end of the thigh bone, which is the femur, that long bone. It crosses the end of that bone at the knee when you extend your knee. And it's the presence of the bursa, which are fluid-filled sacs, within the knee joint that actually sort of help it to pass across the joint smoothly. It basically cushions the joint. But what happens is when, for whatever reason, maybe overuse, you get inflammation in the area. This will then cause friction within the joint, and so then you're going to get pain in the outer knee. Okay. This can, probably the most common cause is overuse. And so this is why, runners, cyclists probably the most common cause of outer knee pain, because it's those repetitive movements, that are going to increase the risk of IT band syndrome and inflammation there. So usually when that happens is they'll experience pain in the outer knee. Usually it hits just above the knee joint, and it will really be felt when at the point that the heel hits the ground. So for runners, that will be when they'll really feel the pain, because that's when the impact is going through the joint. And if you ignore this, then what happens is you're going to get inflammation. You're going to actually also get scarring in the joint, which then again, is also going to cause reduced movement and increase the pain around the knee joint. So we're going to start by looking at the symptoms of IT band syndrome. So, as we've said, the big symptom is, pain on the outer edge of the knee. And this is due to inflammation just at the point where the IT band crosses, the end of that long thigh bone. And usually it starts as a sort of a pricking sensation, but will soon develop into more of a stabbing pain. As I say, certainly for runners, when the heel strikes the ground and you're getting the impact through the joint, that's when you're going to feel that stabbing pain. The pain may well radiate up to the thigh, because, obviously the IT band, if it's tight, that's stretching all the way up the outer thigh, so the pain may well radiate. There may also be a kind of a snapping sound at the knee, and also you may notice some swelling, either on the outer edge of the knee or sometimes even just below the knee. So they are the main symptoms. As we've said, generally it's overuse that causes this IT band syndrome. But what are the other causes of this? So the first one would be if you have some sort of anatomical predisposition to, to the IT band becoming tight. So this could be something like a discrepancy in leg length. Some people, for whatever reason, may be born with one leg shorter than the other. And so obviously this can sort of affect the angle that you stand and the angle of the IT band, therefore. Also, if you've got some sort of abnormal pelvic tilt, again, that's going to affect the angle of the IT band crossing the hip, or sort of bowed legs as well. All of these things can cause the IT bands to be tight. And when the IT band is tight, obviously that is going to increase friction, each time the band crosses the femur upon, extension of the knee. Overuse, we've mentioned, particularly, as I say, in runners and cyclists, where you've got these repetitive movements, and also other athletes, so gym goers, who do a lot of squatting exercises. That can also, cause some tightness just through repetition, and, can put strain on the knee joint. Certainly the way that you train, sometimes you, certainly like runners, for example, maybe you want to think about, do you always run on the same side of the road? Because where pavements, although they may seem flat, all pavements are sort of built at a very slight angle to allow for water drainage when it rains. And so if you're always running on the same side of the road and you do the same route every day, then what happens is this can actually create sort of the effect of leg length discrepancy, because one leg is always going to be just slightly downhill compared to the other, which is then going to cause an abnormal pelvic tilt and affect the angle that the IT band will cross the hip and the knee, which, will then obviously start to irritate the joint and cause inflammation, which then causes pain. Also, running downhill. If you do a lot of downhill running, again, it's more stressful to the knee joint and the IT band. You're probably going to notice a harder impact through the knee joint, because your knee is going to require more stabilization, to support all the tissues and, when that impact hits. With regards to cyclists, a big thing can be just making sure, something simple like making sure that the toe clips are fitted correctly for you, because if they're not fitted correctly, what can then happen is that the foot will sort of internally rotate, which again will change the angle that the IT band crosses at the knee joint. Also, even just poor posture when you're on your bike, can probably sort of more likely affect the hip, but also the knee, which again is going to cause the IT band to kind of rub, and there's going to be more friction around that knee joint, and therefore a higher risk of inflammation. Another sort of anatomical issue that can cause IT band syndrome is if you have flat feet. So if the arch of your foot is collapsed, this has actually been linked with IT band syndrome, because where the foot is sort of more pronated, so it's more turned inwards. What this actually can do is cause internal rotation of the leg, which then again will change that angle of the IT band across the knee, but more so it will produce more tension on the outer thigh, which can then go on to cause tightness and increased friction. Poor flexibility of muscles surrounding the knee joint may also create problems. So you'd be looking at your quadriceps muscles in the thigh, and potentially some of the muscles sort of around the sides of the calf. If there's any other sort of mechanical imbalance in the particularly the lower back, in the pelvis, hips or knees, that can all have an impact again on the IT band. But just generally, any activity, we've mentioned running and cycling are the main ones, but any activity, even something like rowing or weightlifting, anything that where you're using excessive knee flexion or squatting positions, that's all going to increase the risk of friction across the bottom of that thigh bone, and increase the risk of inflammation and pain. So that covers really the causes of IT band syndrome. So what do you do if you already have this problem? How do you treat it? Well, as always with most of our sports injuries, is the rest, ice, compression and elevation. So you want to rest the joint. Don't continue, doing 100 squats a day, because it's just going to make the problem worse. Just rest the joint. You can use ice. Some people even find heat packs help, but I'd say certainly while there's inflammation there, you want to be using ice. Maybe sort of every 1 to 2 hours. You can, once the inflammation's gone down, then use heat packs to try and relieve the pain, because that will help relax the muscles around the joint as well. Compression, you may want to, if you've had problems with the IT band or around the knee, you may just want to use knee supports. When you go to the gym or do whatever exercise, just to help support and stabilize that knee joint a bit better. And certainly in something, if you're running downhill, where we've mentioned, the knee sort of is subject to a higher impact and needs to be sort of more focused on stabilization of the knee joint, then certainly those supports could be really beneficial. And also elevation, just keeping the leg up to try and reduce inflammation and just help with the circulation around those tissues as well. So in terms of pain and also inflammation, you can take your anti-inflammatories, something such as ibuprofen, just to help reduce that inflammation. Obviously, do be careful if you have any gastric issues, because ibuprofen can increase the risk of gastric bleeding. So just make sure that you're taking an appropriate one for your own, medical status. Certainly stretching, obviously before and after exercise, and also massage, which is also going to help to kind of stretch the tissues and just maintain flexibility. They're both going to help, but obviously you want to be doing that once the inflammatory phase has passed. Physiotherapy is an option, and they may also be able to suggest some sort of orthotics, just to help support the joint. Some people have steroid injections, but obviously the effects of that are short term. And in very, very rare cases, there may be surgical cases, but that's very, very rare. So in terms of, if it's something that you're sort of thinking you're going to be prone to, maybe because you're a runner or a cyclist and you've got flat feet or something, or if it's something that you've had problems with and you are looking for ways to prevent it from happening again, these are some of the things that you can do to help prevent the onset of IT band syndrome again. So the important one, in reducing any kind of sports injury, is to really just maintain both the flexibility and the strength of the muscles, specifically around the lower back, the hips and the knees, and also in the lower leg. And you can do this, as we've said, by stretching or by having regular massages, sports massages in particular. Potentially even something like yoga may help. Certainly when you're training, don't overdo it, because if you can push yourself so far, but if you push yourself too much, it's not going to do you any favors. It's just going to increase the risk of inflammation through those repetitive movements. For the runners out there, run on even surfaces where possible. Try to vary your route every day. Try to get a sort of combination of uphill and downhill. And certainly if you have sort of had any sort of little aches on the outer knee or any issues with inflammation, then I'd say, maybe you might want to leave downhill running for a little while, just to, reduce the sort of increased need for sort of stabilization on that joint and reduce the impact. Also, running shoes. Are you wearing like, 3-year-old running shoes that are kind of got a bit loose around the ankle, and really aren't supporting your feet? Always make sure that if you're a regular runner, really look into, replacing those running shoes regularly and making sure that they really support the foot well. For cyclists, ensure that your toe clips are fitted correctly to suit you, and that your feet aren't pointing inwards. They should be pointing straight ahead, so that the angle of the IT band crossing that knee, isn't going to be altered. And again, something your physio can help you with. If you have flat feet, also just look into putting arch supports in your running shoes, or even if you're a gym goer, just use those so that your foot is in the correct position. Because if one part of the body is out of alignment, it has a knock-on effect on everything else. So it is quite important. It may seem like something small, but it can really actually make a difference. So, okay, so we're also now just going to briefly talk about a few exercises that you can do as a preventive measure and as a way of just trying to keep that IT band as, in as good shape as possible. As we've said, it is a very sort of thick, fibrous connective tissue, so it's never going to be as stretchy as muscle tissue. But yeah, there are some stretches that you can do to just help stretch down the outer thigh and therefore, reduce tightness where possible and therefore reduce the friction across the knee joint. So, if you decide to have regular massages with a sports therapist like myself, you may find that they will also do some passive stretching with you, just to really try and improve the flexibility of the joints, if any tightness is noted. So this, this stretch that's shown here may be one that that they will do with you, just to stretch down, down the outer thigh here, and try and maintain a little bit of flexibility in that IT band. But of course, there are a couple of stretches that you can do yourself at home. So this first one is a side-lying IT band stretch. So you're laying on your side, as you can see. You just pop your foot, the lower foot, across the top of the upper knee, and you pull the foot, which is on your knee, down towards the floor, stretching the outer thigh along here. We then have the seated hip and IT band stretch. Pretty self-explanatory from the picture here. So just sitting on the floor with legs straight out in front, cross one leg, cross over the opposite leg, placing the foot at knee level, and supporting that raised knee with the elbow, and just turning back, and you'll feel a stretch just around the hip here and up this outer thigh here. And then the final stretch that I'm going to talk with you today is the knee to the opposite shoulder stretch. So laying on your back on the floor, and you just bring one leg flexing at the hip and the knee and supporting by the knee. you just bring it across the other leg up towards the opposite shoulder. And in this case, you're going to feel a stretch again around the hip there and along the outer thigh. So as you can see, nothing sort of hugely complicated, quite simple ways that you can help to prevent, the risk of IT band syndrome. Hopefully this has given you, the information that you need to really identify whether that is the issue that you're having. Just good luck with the stretches, and self-help measures are always a good place to start. So that's it for the IT band from me. And as always, if you have any questions, feel free to comment, or you can contact me through my Facebook or Instagram pages, which I believe there are links down below. Or feel free to subscribe to my channel on here, because there will be certainly more sports related posts coming soon, and videos about specific injuries and how you can basically identify whether that is the issue that you have, and also how to prevent it, how to treat it, and causes behind these injuries. So more information coming. But for now, that is it from me. So I will see you next time. Okay, bye.